I have the pleasure now to welcome to the main stage two guests. And the first is to share, we're honoring someone very special with our first mental health hero, maternal mental health hero award. I see Nancy Byatt has joined us. Hello, Nancy.
Hello.
We also see, there we go, Dr. John Straus, our honoree, is with us as well. I also want to just remind folks that you can see that our Monica Kira is with us illustrating some of the sessions that we're showing today. And so I have a funny feeling there's going to be a great illustration of you, John, and Nancy for today's session. But welcome to both of you. It's my pleasure right now, as John takes off the headset, right? John, getting comfortable here. It's my pleasure to share that Dr. Straus, you were instrumental in creating the Massachusetts Child Psychiatry Access Program. It was foundational in paving the way for the Massachusetts Child Psychiatry Access Program for moms, MCPAP for moms, which so many of us in this space have looked to and gotten excited about the work that you're doing for so long. This model has inspired the creation of perinatal psychiatric access programs in other states, which we're so thrilled about, and your support from both the sidelines, John, and the trenches has been critical to our field of maternal mental health. And therefore, 2020 Mom and this amazing network that's behind us is so excited to award you with the inaugural annual Maternal Mental Health Hero Award. Thank you so much, Dr. Straus, for all that you've done for mental health, for kids, babies, moms, and so many more. Congratulations. I'm going to actually clap. There's the award. Thank you, John. Congratulations. And Nancy, welcome to the stage. Dr. Byatt, we're so grateful that you're with us because you were the first to share that if there was ever somebody we would want to honor, that John Straus is really an unsung hero, and we couldn't agree more. So thank you so much, Dr. Byatt. Dr. Straus, is there anything that you want to say before Nancy and I get a chance to just chat with you about your career and all that you've accomplished?
Oh,
Doctor, I think you're going to need your headset. We're not hearing you. You're not muted, so I think you just need to select your headset.
The joys of technology, right? Even for an awardee, these things can be difficult. There we go.
There we go.
oh, there we go.
We got you, John.
I guess
Thank you.
I'm so used to using my headset. I guess the microphone was off, but I was trying to let my wife hear, but she's gonna have to catch it later. All right. So, but really, it's a beautiful plaque, and really thank you. And I'm really honored. And you know, it really takes all of us to do what we've done and what's happened. And Joy and Nancy and many of you in the audience could get this as well as I could. So I really thank you all. And it's, I think, as I know you've heard over the last couple of days, the stories from women who have seen what can happen. It really does help. I mean, it really is rewarding to know that we're being able to be helpful. So thank you again. And I know you'll hear more about me as Nancy asks me some questions. So
Yeah.
thank you.
Yeah.
Congratulations again, Dr. Straus, and Dr. Byatt. I'd love for you to be able to make a few comments.
Yeah, so first, just congratulations, John. It's really just such an honor and pleasure to be here with you today. When Joy said that she, mentioned a few years ago when I said, there's one person, it's John, because you're kind of been, probably a lot of people know about MCPAP for Moms, but you've really been so critical to all of that and just to the entire model in itself. And so it's a deep honor and pleasure to, congratulate you. And I'm very excited that you're getting this award. And I'm curious to hear a bit more about, I know the stories from the MCPAP for Mom side, but for all of us here today, for us all to hear about what was the impetus for this originally. So when, MCPAP for kids first started, which for those of you who may know, there was MCPAP for kids. It's now become a national model that's all over the country. That then inspired MCPAP for moms, which John was a critical mentor for me and for our whole team in providing leadership around the MCPAP for moms, which is also now a national model. So it really started with MCPAP for kids. And now there's all these other MCPAP models. There's now one for autism. So a lot of us in this space know the maternal mental health part. I'm really curious to hear about the impetus for the very original MCPAP for kids and kind of what inspired that, and to hear a bit about that story.
Yeah, well, thank you, Nancy. It's really kind of, I think, people talk about serendipity. It actually didn't start with the kind of concept that we've grown into that, is really to bring up the capacity of frontline providers to provide a service that it usually had been only available to specialists, and that couldn't reach the entire population. And when this started back, first of all, it's almost 21 years ago. I'm sorry, 19 years ago, almost 20 years ago, in 2002, when the administrator for the New England Medicaid and Medicare programs realized that the use of kids' psychotropic medications were off the map. They were going up and up and up, and he didn't think that was right and wanted to know what to do about it. So it had nothing to do about child psychiatry scarcity or inability to get behavioral health services. So it started really with this idea around medication. And they had a conference, and the suggestion came up, let's see if we can, we realized that primary care docs pediatricians were prescribing a lot of those medications. Could we help them by doing consultation? And the folks at the University of Massachusetts, where Nancy is, volunteered to see if they could test that out with their network of practices. And they did that. And the fellow, Ron Preston, who had this idea to worry about the medications, then became Governor Romney's at that time Secretary of Health. And he said, we got to make this work for more than just a few practices at UMass. And I was in a position working on a contract for the Medicaid program in Massachusetts that allowed me to see what they had done, started at UMass, and then try and figure out how to make this work for a whole population. And it came, as I heard more and more I heard about this, I realized that it really was an opportunity to provide behavioral health care to all kids and through their primary care practice. And the idea that the old adage that we often use in these programs, which is, if you give a person a fish, that only lasts a day, but if you teach a person to fish, it lasts a lifetime. And our real mantra is that we're teaching folks to fish. And we're not doing it. We're not writing out prescriptions. We're not seeing everybody and then saying, oh, now you can go do this because we've given it your blessing. And so that's how it all started. And then in 2013, Nancy, 2012?
Yep, 2013.
And again, serendipity, the stars were totally aligned and we didn't sort of know about it. So here was Nancy, who was on a NIHK award, trying to see if, knowing that women who get postpartum depression, most of them are identifiable before delivery. If you could get the OB world to screen and treat, we would prevent the postpartum effect. And she was working on that and proving that worked. I was working on the kids, and we were just beginning to say, how can we want to get all the pediatricians to screen, but we can't do that unless there's some place to help when they get screened positive, when moms in the pediatric office get screened positive. And then we had a wonderful legislator, Rep. Story, who was worrying about this at the legislative level and created a postpartum depression commission. And there was one meeting where I met Nancy. I think this is true, as I remember it.
Yeah,
Nancy came and talked about it, and
Mhm.
I was there because I was interested in how we could
Yeah.
do this for kids or in pediatric practices. And I said, well, we got to make this work. And then I went home, and in the shower, I realized that we had gotten some extra money from a grant that I could probably do a little bait and switch and fund the new program. So I went back to Nancy and said, how about let's start.
I said,
And
yes.
so,
Yeah.
That's
and
great.
it's been a wonderful partnership between Nancy's wonderful clinical leadership and my ability to wangle programs so that it's been great.
And you, John, your ability to wangle programs, as you say it, is quite something. I mean, the way you can think about what's clinically needed and then work with the legislature to kind of fund something that's practical and that is going to be sustainable is it's truly, it's really amazing. And that's something that is, and as we see, we have this ripple effect because it's very hard to do that and to create things that are sustainable and they're going to work over time and that can be funded in the way that this access program model has been.
So in Massachusetts, we've grown. We now have, as Nancy mentioned, we have an autism branch. We have a substance use branch for teens, and we have we've started an adult program for chronic pain and substance use addiction issues, and they're all going very well. So it's a model, and that obviously is spreading across the country, and you guys are all supporting us. So it's really nice, and we couldn't do it. I also say that we couldn't do it without the community advocacy from folks that realize that this is important. If it was just us, us clinicians talking, that wouldn't move the funders. It's really you guys who move the funders, and I can't say that often enough. It's just the stories and the expression of need. I mean, people often say, well, what's your return on investment? And I think Nancy, in the postpartum space, there is pretty obvious. In kids, it's much harder to deal because it's a long term. A lot of the payoff is when they grow up, and it's but the real thing is what you say is, if I can't, when I couldn't get care, I was in big trouble. And the access is really, to say access and not to put that in dollar signs, really needs to come from you guys. So.
Well, thank you, Dr. Straus and Dr. Byatt. Really interesting background, and I think so many of us would have thought, just like in the postpartum or maternal mental health space, it was about getting more access to psychiatric treatments. In the case of the Child Psychiatry Access Program, like having the data that said maybe we're over prescribing. It's really interesting to hear that it started with data and people that had time to look at data. And the innovation, the space for innovation that came out of UMass and then bloomed with your support, Dr. Straus, are really interesting and important nuggets there, I think. It was also a really good segue. I want to ask you all, both of you, about this program. Obviously, there's a lot of interest and it's working, and that's why people are wanting to scale it. And again, for those who are new to the MCPAP model, there was a breakout session on this work that HRSA did, the federal agency, just a while ago. But for those who haven't learned too much about MCPAP, it's about providing obstetricians in our case and others who call and need support with what we call a lifeline. Thank you, Dr. Byatt, for you and your team to coin that term and use that phrasing, a lifeline to get support around how to treat these disorders, so that, as Dr. Straus said, they don't just screen and not know what to do. That's the background. But John, Dr. Straus, you shared, thank you to the advocates and the stories like the one we heard this morning. This really matters to drive funding into the program. Can you talk a little bit, both of you, about initial funding and then sustainability of funding, and that it took, my understanding is, advocacy opportunity and policy to create long-term funding structures where insurers now pay into the pool to fund this ongoing in Massachusetts. That's really interesting. Anything you want to share on that front?
Well, Joy, data speaks, and it was interesting when when I first was designing the kids program, I actually got a stakeholder group together that included all the insurers, and they were very positive. But yes, this is something we need. We don't have enough child psychiatrists. We're all for it. And then when the Secretary of Health decided that they'd support it being a government-funded program, all of a sudden the insurers didn't want it. But I knew that eventually it really needed to be paid by everybody needed to contribute, because this, as you all know, mental health issues are universal. And so we always kept track, and we'd done it with McPap Vermont as well, who the insurer was of the person being called about. And so over the years, we kept on saying 58 to 63% of our calls are from commercial payers, and they're not contributing anything. And eventually the legislature just said, that can't be. And they, with the advocacy of the community, passed a law that said that the insurers had to pay, in Massachusetts, have to pay their share, and they get surcharged once a year to contribute to the program. So it's really, and you guys are, I think, the California model that the bill is hopefully going to make it this year, right? Is really a even better model than ours. And it's so I think that moving that these programs should be an essential part of the healthcare system is really the way to go, and should be paid for by, obviously it'd be nice if it was single payer, but in our current world, it's multi-payer.
And I would agree. The thing I would add is sort of echoing what John said, what you said earlier, John, about a lot of this is about relationships, I think, with advocacy. And you all know this because 2020 Moms and many of the people at this conference are, it's a lot of it. It's, I think, what part of why MCPAP, from a huge reason why that is funded and why all of the HRSA grants, it's because of people with lived experience getting out there and banging the pavement and telling their stories. And I think that moves the legislature. And I think that's a big part of why when I think of the advocacy journey, I feel a lot of gratitude towards all the advocates who are doing that. And we work in partnership with them, and we can go and talk about the model, but we really need the people with lived experience, because I think that's what really pulling at people's heartstrings is what I think ultimately makes a big difference when it comes to advocacy. So I think that's a big part of it. And I've felt very grateful for all the relationships that have been developed through that. And I think in Massachusetts, the Postpartum Depression Commission is a big part of that, because it's the relationship with advocates, and it's also with the with the legislature. So I think that's been a big part of it too. And that's been a really I think that's an important piece.
Yeah.
Great.
And the personal story. Sorry, Joy. Go ahead.
No, you go ahead.
No, just saying, and the personal stories, these are the issues we're talking about, affect legislators as well and their families. Yeah. And right. You'll often find, as I'm sure you guys have found, that you find legislators who have been through an issue that they understand the need for these kind of programs.
Yeah, I was going to add one more thing, and thank you for that, John, that the bringing postpartum depression out of the Shadows Act that so many organizations got to work on the Hill of, what was it, 5 or 6 years ago, that provided grants to states. Now that's seed money for states, but it takes an effort to sustain these programs long term, and that's where what we're talking about now really comes in. So it's a sort of a two-pronged approach. And it's great to hear that you like what's happening with the California bill. John, we're going to quote that and make sure the legislature hears that too from the expert. So thank you for that feedback. I know Nancy and I both have a few more questions for you. And Nancy, I know I've got one on the tip of my tongue, or I can turn it back to you.
You go ahead, Joy. Ask the question that's on the tip of your tongue. You go ahead. I'm curious to hear it now. Go ahead.
Yeah, well, it's really about federal funding again. And John, you had mentioned that there's some new federal funding on a conversation that the three of us had a while back, but was earmarked for children's mental health. Is there anything interesting that's brewing, perhaps through the COVID relief funding that others in the space of mental health and teleconsult should know about?
Well, just to make sure everybody knows, is that as part of the American Relief Act, a number of organizations were supportive in right now for the pediatric programs. 21 states are supported. So there was $80 million put in that bill so that over the next 5 years, the remaining states and territories could all receive that initial funding. And where it's what's not clear at the moment, and I don't know if any of the HRSA folks are on the phone, but there are a number of states that have pretty robust programs already and don't have HRSA funding. And so hopefully there'll be an opportunity for those states to apply to do more focused expansion, which could be perinatal, I would hope. And so that might be, there may be some opportunity, even though it's focused on pediatrics. Obviously, health of the infant is directly related to mom's health. So hopefully there'll be a case made for some states to be able to expand in terms of perinatal. Now, of course, they may choose to do something else, but priority-wise, perinatal is certainly key. And but I think that now that Congress has recognized these kind of programs as a universal, and it was widely supported, universal need, I think that gives you a platform, Joy, to go out and say, we need to do the same thing for moms. So to go from the 7 states that are currently funded to, again, 50 states and territories. So
yeah, so exciting, John. I think Adrienne Griffin from Maternal Mental Health Leadership Alliance is probably getting very excited about those words too. Thank you. That's really great background. Nancy, anything? I have another question for both of you, or we can turn it back over to you, Nancy.
Well, please go ahead, Joy, with your question.
Great. I want to ask both of you if you could wave your magic wand to do anything in mental health right now, whether maternal mental health or just generally, like what do you see that still needs to be fixed?
Nancy, go ahead.
And Dr. Straus, we'll start with you.
Yeah.
Start, Nancy, you start.
Okay. So I would say that I want mental health to be truly on par with physical health. And I think that needs to happen in 3 ways: a societal level for us as individuals and in healthcare systems. So on a societal level, that we as a society value mental health as much as physical health, and that we see it truly on par, that you can't have physical health without mental health, and that we as a society value that and encourage that. And then on an individual level, that we all as individuals see that we ourselves get the mental, health support that we need and deserve. We do that for our families, and we don't, for example, do the many things that many of us do because we don't want, because of the stigma around it. So I think that's the other piece. It should be like going to the dentist. We should be telling our neighbor, hey, I went to my therapist today, because we wouldn't tell them we didn't go to we would, just like we tell them we went to the dentist. We respect people going to the dentist. We know it's good for their teeth. Going to therapy, seeing a psychiatrist when that's needed should be the same thing. And then also that it's on par within the healthcare system. So for example, if someone needs mental health treatment, it's valued from and incentivized as much as physical treatment, and that it's not, and that we incentivize healthcare systems and people get reimbursed the same if they're providing mental health care and physical health care. And that's the thing that I think I would really like to see change. And I think would be most important among the many other things, but.
Yeah. payment integration, paying health providers for mental health services is critical. That's great, Andy. I love that analogy. Like, we'd almost be ashamed to not go to the dentist.
That's right.
It's sort of the reverse, and that's really where we need to be for mental health. That's brilliant. I love that. Dr. Straus,
I want it to be
what
like,
would you change?
Okay, so I totally agree with Nancy, but I'm going to take a more global point of view and say we need to treat health in terms of public health and and our community. So what we've learned over the last year, when we have a very broken public health system and a very inequitable treatment system, the COVID has been horrendous, right? So, and it wouldn't have had to be. We know there are places where it's been treated well. And so in terms of mental health, if you just look at the individual, it's not preventative. So we need to look at the community, the support of how your survival, and in terms of basic needs, economic needs. I think your previous session about loneliness, how you have a community, how we all the social determinants of health. I mean, those are going to have, in the long run, are going to have much more effect on mental health than we can do individually, one person at a time. So I would make a plea for us approaching mental health as a community problem and issue, and what are the factors, and even you can even go to the EPA. I was thinking the other day, because I was hearing a lot about endocrine disruptors in our water system. I mean, what is that doing to our mental health and particularly depression? So in postpartum period. So it's I think that's where we need to go, and we're very backwards with our public health system relative, and our social network relative to other developed countries, and that's why we have much worse outcomes, medical outcomes.
I love that, John. So it's what I hear you saying is that mental health, that by prioritizing mental health and having that be part, that it's helping the entire, it's helping the whole community, that it's a community problem. It's a community priority, right? And that we're helping the entire community, and then potentially and that all the ripple effect that can have if we're attending to all of our mental health and just seeing that as a major public, as a public health. Yeah, I love that. It's very.
And we know right now with our kids, when we haven't been able to be out in the community, what that's meant for our mental health and our kids' mental health.
Right.
I mean, this is a year that no one's going to forget for a long time.
Right. And it sounds like you're also saying, seeing as a part of that, the social determinants. So like, we can't separate mental health from social determinants of health, but as we're addressing mental health on a public health level, that included in that is social determinants. Because right now it's very medically focused, right? You have a diagnosis, we try to treat it, but it's to integrate it all. That's what I hear you saying. Yeah.
Really.
And and even in terms, I'm sorry, one last thing, even in terms of treatment, we focus on very individualized, licensed clinician kinds of treatment, but we know in the perinatal mental health space, if having support groups, having doulas, I mean, having all those other kinds of resources is as important as having Nancy see you and give you the right medicine.
I agree.
Great, you guys. I love this conversation, and it ties into what we were talking about yesterday, but around levels of care, right? And that care is not just clinical care, it's community-based care too. And I love the plug that the public health system, right? There should be more of a system that is accessible to everyone, and we have to address poverty. John, great items to tackle with the wave of a wand, if you could. Thank you both for those thoughts. John, I want to leave the session with two things. First, I want to ask you one final question. For those that are younger in the field and just getting started, you've had such a great, long, successful career. Is there any just words of wisdom that you want to leave the rest? I want to say the rest of us, but I'm not so sure I'm so young anymore, but those that are new to the field and have a great long career in front of them, what advice do you have?
Do what you love. And when you find something that you're good at and you love and it's rewarding to you, go with it. I think too often we're worried about where the next, how to make more money or how to have more power or a bigger position. And that's not going to make you happy in the long run. It's, there are people who want to be president, but not everybody. And don't think that your goal should be president. It's to do whatever you fits best with what makes you happy.
Amazing, love it, and do what you love. That's a great quote. On your superhero drawing, I see that Monica has up there. I can't wait to see what you finish, Monica. And John, in closing, we have a short video from one of your colleagues that we want to show now, and just a short one. And we again congratulate you. That's coming right up.
Thank you.
On behalf of the McPap and McPap for Moms teams, I congratulate Dr. John Straus on winning the inaugural Maternal Mental Health Hero Award. You are the heart and mind of the Massachusetts Child Psychiatry Access Program, McPap. Your leadership and innovative thinking has helped so many families across the state as well as the nation. It is true that not all heroes wear capes, but you are a hero to many providers and families struggling to find mental health services. You have led the charge in thinking of new and creative ways to reach vulnerable populations while building a stronger workforce to deliver mental health services. You are a true inspiration and wonderful man. Thank you and congratulations on your well-deserved award.
Oh, how'd you get
John,
that? Thank you.
We did that behind the scenes, John.
Congratulations again, John.
Congratulations, John.
For those people who don't know, that was Beth McGinn, who's our program manager, and for both McPap and McPap for Moms.
I love the cartoon here.
Thank you to both of you. Congratulations again,
Thank
John.
you.
And thank you for your work closing gaps in mental health and the maternal mental health care, and for inspiring us to do what we love. We're very grateful, and congratulations again.
Thank you very
John.
much. Yeah.
Everyone, we're going to take a short break before we head to our networking sessions at 2:15. Those networking sessions will begin at 2:15 Pacific time, and we'll be back later today for an optional main stage session on the topic of postpartum psychosis, where we're going to hear from the documentary film producers of Not Carol, also being joined in that session by April Domboski, a reporter from KQED, an NPR contributor, and several others on that panel. We'll get to watch a few snippets of that film together. We invite you to join us back. That will be happening at 3 p.m. Again, optional. Hope you all enjoy the networking topics here in about 7 minutes or so. So at 2:15 Pacific time. Thanks, everybody.